The first step is to verify the doctor's order. Some hospitals requires doctor's order. I'm not really sure with our hospital here because I'm not going there for several SEMs. You need to check if there's an order of wound dressing. You need to check also nurse's previous documentation, because sometimes the previous nurse was able to change the dressing already and you do not want to repeat it again, because normally it is done daily. That's why you need to check doctor's order and then nurse's documentation. Okay, and of course that includes what are the dressing type that will be used for the patient, what are the cleaning agent that has been ordered by the doctor. After you check the doctor's order and the nurse's documentation, and you are sure that there's an order for the dressing and the previous nurse did not do the dressing itself, that's the time you can go to the patient and start the procedure. Okay, now when you start the procedure, make sure to bring with you clean gloves initially. Okay, and of course our hand hygiene, just like what we do. Okay, go to the patient's bedside. You need to introduce yourself. You need to identify the patient. You need to do hand washing, and you need to explain the procedure.
As always.
Kalas, I'm not going to do it, Hama. Okay? And of course, you start with, after you explain the procedure, you start with assessment. That's the usual thing that we do. We assess the patient's condition. So what are the things that we need to assess? First, we need to assess for presence of local and systemic infection. Okay? Now, if you want to assess local infection, you need to check exactly the wound area. And at this point, I'm going to wear gloves. This is very important. Okay? Maybe you can start by asking, ma'am, we're going to have a dressing. Do you have any allergies to the cleaning agent? Why we ask? Because some hospitals are using betadine. And betadine can cause allergy, right? Because it's from shellfish. That's why we need to ask. But normally in some hospitals, they're just using normal saline solution. It depends on the institution that they are working. Mommy, do you have any allergies to betadine or to a cleaning agent? And then the patient would say, no. Okay, and the next thing that you're going to do is to expose the wound. Okay? First, you need to check for the location and check for the size. You need to check for the size because later on when you prepare the dressing material, you need to choose the right size. We have big, medium, and we have small. So the location, I have checked, and the size, it's in the neck area, and the wound is medium size. Okay, now I'm going to assess for local signs of infection. They know already the cardinal signs of infection. They can ask if the patient is in pain. They can check if the surrounding tissue is inflamed or swelling, or if they can see a visible exudates coming from the dressing itself. Okay. Now, if the patient says the patient has a pain, we need to elaborate if the patient received pain medication, because these procedures can cause pain to the patient. In most hospitals, we give pain medication to the patients prior to the dressing. That's why we ask, do you have pain? And then I will check if the patient received pain medication. If not, I might give pain medication to my patient also. And you check also for systemic signs of infection. And most specifically, the common signs that we check is temperature of the patient as a fever. Or you can check also other vital signs, but temperature is very important.
And
okay.
that data.
Yeah. Now, after you do those assessment, okay, you can now, okay, close this one back again. Do not remove the dressing. We will do that when we return. Okay, ma'am, sir, I will just prepare the materials and I will be back. And then the gloves, and then you perform your hand hygiene. Shortcut. Okay. This is used already. So at this point, I'm going to prepare my materials. I need to have a separate trolley. Even in the hospital, in each ward, they have a trolley. And this is intended for one dressing and other small procedures. Aside from that, I'm going also to prepare other materials. Okay, so I will prepare a gauze.
For what?
Normally, it should be sterile. It should be, individual package, but we don't have. We will use this one to cover the wound initially. Okay, and we need to have another clean gloves. And of course, we need to have basin. Wipes, we will use this one to clean the trolley. In some hospitals, they're using alcohol. Okay? Depends on the institution, but it should be cleansed. Okay? Inco sheet also is very important because we're going to provide inco sheet under the wound area because there might be solution that might spill into the bed. Aside from that, this is the most important. We call this one as dressing pack. Expiration dates are checked. I'm going to show you later on what is the content. And of course, most importantly, because this is a sterile procedure, sterile gloves. Yeah. Okay? Since the doctor's order is to clean the wound using normal saline solution, I have prepared a normal saline solution. And since I have assessed that the wound is small, I prepared a smaller, very small doses. Okay? And of course, to remove, to remove the dressing, the old dressing, I need to use adhesive tape. They might be confused with alcohol swab and adhesive tape. This is adhesive tape. I will put it there. Okay, now.
In hospital, use alcohol, so.
Yeah. Sometimes this one.
Yeah, oh.
Yes, they just do it like that. But here, you are following the standard one. Adhesive. Now, the next thing that I'm going to do now, before I return back to the patient, is to clean the trolley. And you need to understand why it is cleansed. Because this is used for all patients. And the procedure requires sterile procedures. And you do not want to bring microorganisms to one room. That's why before you use it for another patient, make sure it is disinfected. And normally, what we use to disinfect this one is our wipes. Now, they can wear or they might not wear gloves when they clean this one. But in the hospital, normally this one is cleansed after every use. But to make sure that it is really clean and disinfected, before you use it again, you need to clean it again. Okay? So, they can wear gloves or they might not wear gloves in cleaning this one. It's fine. Okay? And this one requires a technique as well. Just like...
Center.
Yes. If they're unsure with the cleanliness of the table, they can wear gloves. Okay? Start from the center. Again, in circular motion, just like what we do. Because the center is the cleanest. I do not know if they are doing this in the hospital.
Student, yes, do it. In
Students.
adults, yeah.
Yeah, but I think nurses, they just go directly.
Nurses
Okay.
never clean it.
Okay, they can dispose this one if they think it is already dirty, okay? And they need to clean also the side. In one direction, they cannot just go like this or else they are bringing back the microorganism. Also this one. This is the procedure that takes time for students to do. But you need to understand that this is very important. Okay, you can use the other side. And you can dispose. Take it again. Start from the center. Some institutions are putting alcohol and they put flame to sterilize.
It's a little dangerous.
Yeah. In the Philippines, they're using that fire.
Really?
Put alcohol and then put fire.
Wow.
Yeah. To kill microorganisms. Okay. Use the other side. And you can do the other side. And this is already disinfected. So at this point, we're done with this. You can now prepare this one because I'm going to go back to the bedside of the patient. Okay? I can put it here. And now, I am ready to go back to the patient's bedside with this. Okay, again, they have to identify the patient. Okay, that's part of the identification of the patient.
Re-identification.
Yes. Okay?
It's mandatory?
And they have to hand it up again.
Okay.
Just like what we
For
do.
this procedure, is it mandatory? Re-identification?
Actually, it's for all procedure.
All procedure.
Every time you go back to the patient, you always re-identify. It is standard for all procedures. Every time you go back, you re-identify the patient. Okay, at this point, I'm now on the bedside, I have my materials with me, and I'm ready to perform the procedure. Okay, you may start by changing the level of the bed because this procedure might cause strain on your back. Okay, since the wound is in the neck area, so supine position is fine with me. Or it's fine if I can elevate the head part a little bit. It depends on the clinical judgment of the student. Or they can raise the bed, the height of the bed, or lower it down. It depends on them. But for me, I need to elevate it because it will cause back pain.
So adjust the bed level.
Yes. Adjust position of the bed and adjust the height of the bed. It's very important. Okay? Now, the hospital setup is arranged in such a way that the sink is near to the bed, especially if they are in a private room. You need to discuss that because later on they might do surgical hand washing, and normally we do it in the adjacent sink near to the bed. The hospital, the sink are near to all the beds, so it's not a problem. Okay, so now what I'm going to do now is
Surgical hand washing, right?
not yet. I'm going to prepare first the set. I'm going to first remove the old dressing
Okay.
that we have. So at this point, I'm going to remove the old dressing and I'm going to do my second assessment with the patient. Yes. Okay? So at this point, just like what we did earlier, I'm going to wear a gloves.
Killing gloves.
Clean gloves only. And at this point, I'm going to remove the old dressing using the gauze that I mean the adhesive remover that I have. Now, the technique in doing this one is to wet all sides. Because if you have a dressing, these are the ones that sticks to the skin. So what we normally do is to wet all sides. In some hospitals, they're using the hand rub.
Yeah.
But here we're not doing that. Okay? If they have two separate kidney basin, much better. Okay, I'll take another one. Okay. Here's the technique in removing the wound dressing. When you remove the dressing, you should remove it towards the center. So I'll start from the edge. Okay? While I'm removing this one, I need to support the skin with my other finger. Why? Because if you just do like that, it's painful. So support the skin with your other finger like that, shwaya. Or you can actually apply adhesive remover just beneath the dressing. See, I'm supporting towards the center. It's painful. This should be very careful. See. After all sides are loosened, that's the time they can remove it using their palm. See? Using my palm, I'm going to remove the old dressing, keeping away from patient's sight. I don't want my patient to see this one because this is very awful. That's why it is covered by my hand. Okay? Now, before you dispose this one, I want you to do your assessment. Assess
Secretion.
Yes, the secretion, the exudates, including the amount. If this is saturated or not, you need to tell them what is saturated, what is unsaturated. Saturated is full of fluids, blood, or exudates. So I will check for the type of exudates. I will check for the amount or saturation of the gauze.
And odor.
Actually, they can also assess for the smell at this point. Okay? And after I assess this one without the patient looking at it, I'm going to dispose this one with my gloved hand. Okay. Now, at this point, I'm not going to remove this one as I'm going to do my second assessment. So I'm going to assess the wound. At this point, I'm going to assess for the wound approximation, which we have discussed earlier. Okay? The wound is approximated, which means it's close together. I might check also for the presence of any exudates coming out from the wound. Okay, what else? The appearance of the wound, you have to check for it. Okay, and they can check also if there are swelling or inflammation in the surrounding tissue.
Redness, irritation.
Yes, those things that you can visually see.
Silent symptoms of infection or healing process. Yeah?
Yes, infection or healing process. In some instances, they can even do palpate way on the sides because if it is infected, sometimes it is painful. But since our patients might have taken pain medication earlier already. So after you do the assessment, they should not leave the wound open. You need to take the sterile gauze at this point where using their gloved hand and cover it. I need to cover it for the meantime because I'm going to prepare my table. And then remove the gloves and then I will do hand
Surgical.
hygiene again. So at this point, before I do my surgical dressing, I can prepare my equipment first. Because later on, if my hand has been cleansed and scrubbed, I cannot touch anywhere.
Yeah.
Okay, so. Okay, now, before you put on, I need to prepare this one, you can apply this sheet. Since the wound is here, okay, maybe I can put it right here.
It's
It depends.
optional, right? Based on.
It depends on the placement of the wound. If the wound is on the hand, it is here. It depends on them. But
Sometimes it's, for example, in abdomen. No need to indicate.
no, usually we use it here, like this. Okay, it depends. And since it is in the neck, maybe we can put it like that. Depends on the location. You need to tell them. Because some drips of solution may go there. Okay. At this point, I'm going to prepare myself. This is very important. This package contains sterile materials. And when you prepare this one, make sure not to touch the inside part of this. So, the first thing that they're going to do is to take note of the flap. All sterile package has a flap. A flap is an area where they can easily open the package. See? They cannot just do like that. This is the flap. See? Now, at this point, they have to slide the content of this package into the table without touching it. Okay. Now, how do they open this one? It requires skills so as not contaminate the inside part of this set. So there are flaps or there are flaps that they can see. See? You can hold this flap.
Outside.
Yes, and then they can open it on the other side. Next, they have to look at for the next flap. The next flap is here. See? To that side. Make sure not to touch the inside part. The white part should be sterile, but I can touch the blue part. See? At this point, this side. Make sure not to touch the white part. At this point, the remaining side is this. Only in the edge. See? Make them realize they should not touch the content. Okay. So at this point, I'm going to take the yellow bag. The yellow bag, it is where I'm going to dispose the materials that I'm going to use. So how do I do that? I just do like this. And then, I just elevate it in order for me to pick. This is for the garbage, just like oral care that we did earlier. And I think they know already how to anchor this on the side. See? Without removing the entire this one, you can put it here because my working area is here and it should be near to my place. Okay? And they're not supposed to put it straight or else they cannot open the mouth. You do it like this. And the mouth is open. At this point, I'm going to prepare my other materials. The dressing itself, again, you have to look at the flap. The flap has a marker, see the arrow? That means the flap is there, it is where they're going to open it. And when they open this one, they need to use this open and then turn it upside down. Okay. At this point, I'm going to put the cleaning agent over the table. So how do I do that? Normally, it's very difficult, sorry. Okay. We have to expose the gauze because it is where they're going to put the normal saline solution that we have here.
So
Okay?
soak it, yeah?
Yeah. They have to check the expiration date, they have to open it, and maintaining a higher distance, they have to wet the gauze. It should not be too low or else you're going to contaminate it. Just an adequate space. Okay, if they think they require more, they can use 2 or 3. If something drop on the area that is considered unsterile, they should not use it
Never
anymore.
touch.
But for now, for the purpose of the practice, this is sterile.
We skip this step.
Yes, we skip that one. Okay, so everything is ready. So at this point, I'm going to prepare my gloves. Actually, I should have another table with me where I can put the gloves. Just do like that. Okay? And at this point, everything is ready. Near the nearest sink, where you can see your patient, use the sink. You never go out the room, you never go out of the ward and wash. Because you need to see that your set is sterile and you have the sight over it. Okay. Now,